Hi, this is Tony D'Amico. Thanks for joining me today for this brief video on a topic that I think is super important, and that's our health. So, health is wealth, and we're going to look at some evidence-based links between net worth, longevity, and what to do about it. I think you'll find this very, very interesting. Just a quick disclosure first is let you know that I'm the founder and managing partner of Fidato Wealth, which is a registered investment advisor. It's important to note that I don't know your particular financial situation, and therefore don't take anything as I'm saying as advice. And while I'll be reviewing links between wealth and health, I'm not a physician, right? So I'm not providing any medical advice either. Nonetheless, I think you'll find this very helpful. So let's talk about where we're going in 30 minutes with this video. It might be a little bit shorter. We'll see. We're going to look at what evidence-based data says about wealth and health. We're also going to look at the drivers that matter the most. And then I'll give you a practical playbook looking at your health span times your wealth span. The goal is to help you protect your health, your options, and your family wealth. Data point number one, which I think is absolutely fascinating, is looking at just mortality and the gap in life expectancy at age 40 between the richest 1% and the poorest 1%. Men live 14.6 years longer that are part of the richest 1% versus the poorest 1%. That to me is amazing and optimistic, but yet I wish it wasn't that case, right? So that's what this is about. How can we reverse that for more people? With women, it's a 10-year difference. I mean, that's talk about adding another decade to your life by having a strong financial picture and maximizing what you have. There is a nuance to this as well. Where you live and what you do also matters. So those, there's about a 4.5 year difference across various areas. And also, if you smoke or not has a tremendous impact on these numbers. But nonetheless, these numbers isolate something I think is very important, which is the difference in life expectancy that having a financially sound plan provides. Let's look at median survival. Data point number two, the average life expectancy for the lowest wealth decile is 72 years versus the highest wealth decile is 86 years. That's about a 13 and a half year difference in survival. That to me is amazing. So again, strong wealth, strong health, and strong health, strong wealth, right? They go hand in hand. Higher net worth at midlife predicted lower mortality over 24 years. This to me, again, is amazing. And, we work with a select group of clients that have complexities with their financial plans and they often come to us at midlife, maybe sometimes mostly in their 50s, sometimes mid 40s, sometimes early 60s. But that midlife period is so important because that's when you typically have accumulated resources and the difference can be made in optimizing them on the go forward. Also, paying attention to health, also an important juncture, very important at this juncture. Okay, let's look at the difference between low income. So low income longevity varies by area, about 4.5 years between the highest and lowest longevity areas. There is a correlation with smoking as well. So there's a strong relationship in low income areas. So why this matters for a wealth and medicine integrated approach. The biggest wins often come from consistent behaviors and smarter environments, not necessarily more doctor visits. And concierge medicine can reduce that friction and improve follow through. And wealth planning can help you fund and protect that consistency. And the crux to this is all about concierge medicine and how that's more of a boutique approach to healthcare, customized. Whereas we all have experienced with traditional healthcare, it can be very beneficial, but sometimes you're just a number in a huge machine. And so getting customized healthcare is one of the drivers that we're going to talk about. So medical care is estimated to account for about 10 to 20% of the modifiable contributors to health outcomes. So what do we control? Our behaviors, our sleep, our movement, our nutrition, use of alcohol, how we handle stress, our environment. What foods do we keep in the house? Access and follow through, getting good advice from curated specialists that are holding you accountable and they're keeping it simple yet effective. So, how can wealth help? It can buy you time, it can remove friction by taking advantage of things like concierge health or chiropractic care or coaching or maybe counseling or other different avenues, a fitness program. And what this does is it protects the plan. So it's so important to have that liquidity and the appropriate insurance so health events don't become a financial crisis. So, what can you do? Again, a concierge healthcare approach. Actually, here, a concierge wealth care approach. Um, so, again, what you can do is you can use money as a resource to enable better health outcomes. This allows you to turn good intentions into systems using time blocks, accountabilities, incentives, fund the prevention without stress by having a well-designed cash flow, monthly cash flow program, and a dedicated health budget, making the healthy choice the default, whether it's travel plans, your home environment, support, preparing for the what if. These are things looking at like, well, disability or long-term care, and then protecting your family. This has to do with things like life insurance, having an umbrella policy, so important for high net worth individuals, and an estate plan that matches real family dynamics. Tax planning is super important, minimizing all that you can pay in taxes and the coordination of all of this. And that could be a wealth advisor, tax advisor, estate planning attorney, and even your concierge medicine physician, all part of one coordinated team. So that way you're not getting advice in a silo. And I'll explain that here in a little further. So, what is concierge wealth? Wealth management is a word that's used extensively. And everyone's definition of wealth management varies. So I'm going to give you mine. So wealth management consists of three components. One is investment management. The second is advanced planning. And the third is relationship management. I'll give you a quick overview of each. So as far as, investment management, that's a very important item because your investments are often the fuel that funds your plan, enables you to afford things like concierge healthcare. And some people do investment management, better than others, but a very important piece of this plan is to have even here, an evidence-based approach to investing, utilizing strategies that you're very comfortable in. And whether you do this on your own or you work with somebody, it's important to understand how you're investing, what the pros and cons are, and how this translates into cash flow. On the next screen, we're going to talk about advanced planning because I think this is a key differentiator. Advanced planning is a higher level of wealth management. It's going deeper in areas. So those areas are wealth enhancement. Here, the primary focus is tax mitigation and cash flow planning, helping you pay the least amount in taxes through careful, proactive tax planning and cash flow planning, looking at your different income sources, looking at the right sequence of distribution, looking at tax impacts, looking at the state of what is the gain of the asset that we're utilizing. Is it from stocks, bonds, mutual funds, real estate? Is it from a perhaps a retirement incentive? What is that? Is it stock options? Coming up with a cash flow plan. It's not just about knowing what your monthly need is and then establishing it. It's going deeper and looking at all those different facets to maximize what you keep. Wealth transfer, some people refer to this as estate planning, but it's much more. This is based upon understanding real family dynamics, empowering family harmony. And that is a both an art and a science. And here you're trying to transfer wealth effectively to family and loved ones, and sometimes charities as well, which we'll talk about here in a minute. Wealth protection. This is to me kind of akin to you're on a cruise and you're going across the Atlantic, and there's all these little icebergs that can take down your ship. So we're talking about things like, what if somebody falls down the steps at your house? Do you have a solid umbrella policy? Maybe long-term care, maybe property casualty things like tornadoes or earthquakes or fires or a car accident, things like that. So here, what we focus on is building a wall around your assets and doing it in a way where you're paying the least amount in insurance premiums. Charitable giving, about half of our clients are charitably inclined and want to make a dent in the universe. And for those 50%, there are so many different tax planning vehicles to significantly amplify the benefit to the charity and significantly reduce taxes. Many different strategies that you do in a very layered fashion. And that also goes with estate planning. Okay, so relationship management is also, very important to us. So we only work with a select group of clients, and we provide a very boutique and a customized approach, just like concierge healthcare does. It's very custom. It's based upon what you need, how you want to communicate, and knowing really what's important to you. And then with that, we know what your North Star, what your goals are. Then we obviously build and execute a plan all based upon that. And that's where the professional network relationship management comes into place. So this total client profile is a great example of the first thing of how we have a relationship with our clients. We take our clients through a discovery process, and we're going to understand their values, their goals, important relationships, advisors that they work with, their asset profile, what sort of process communication do they have, what sort of interests do they have, and we get to know our clients extremely well because the plans that we do are all based upon helping you live your best life. So this is a great example of how we manage the professional network. This is a sample of our advanced planning process. It's color coded. You can see green means completed, yellow means in progress, orange means ongoing, and wealth management is truly a lifelong event. But this is the framework that we utilize for wealth enhancement, charitable giving, wealth protection, wealth transfer. And what we do is we build a coordinated team around our clients. So this is us in wealth management, and with our internal experts, certified financial planners, investment advisors, insurance specialists, and then also outside experts, estate planning attorneys, CPAs, specific risk protection specialists, concierge healthcare. And what we do is we get together once a quarter and we review our clients' goals, how they're positioned, and each person around the table discusses potential gaps and opportunities. So it's really a learning group. We all get together and come up with ideas to maximize what's in the best interest of our clients. And this is where that concierge piece comes together. So what I'm describing to you It's sometimes called a family office. So maybe you have never heard of a family office. Most people haven't. A family office is set up by families that have a net worth of 200 million or more, and they have their all these people on payroll: attorneys, tax, risk, wealth management. They're all on their payroll. They all work in the same office. And because of that close coordination, they get the best outcome. So, what we're doing is replicating that experience for our clients. Okay, so let's look at kind of the joint playbook. And this is a sample cadence, but one is taking a baseline. So we're really happy to introduce you to concierge healthcare professionals that we've worked with on an ongoing basis and that I've used as well and have been very happy with, or perhaps you have your own. But there it's really understanding, getting that baseline, your labs, your vitals, your history. And then on the financial piece, it's doing that assessment, that financial assessment, and identifying gaps and opportunities. The second thing is coming up with a plan. You need to have health targets and health priorities as far as, and also wealth targets and wealth priorities. And then there's time needed. So this needs to be time bound. And there has to be a plan that's documented. Once you have the plan, then number three, it's about execution. And this is where coaching from your concierge healthcare professional and doctor, and from a wealth management professional, that coaching, that follow through, and then doing your best to automate and delegate what you can. You want to create a system wherever possible. Maybe it's automating saving into an account or automating a regular monthly distribution. Maybe it's automating a vitamin that you take that you need a refill every 90 days and just doing the automatic reorder. Those little things really make a big difference. And then stage four would be the review. And this is where quarterly check-ins are important to keep things on track and doing an annual refresh. So the 90-day kickoff here, we try to keep it simple. Week 1 to 2 is getting that baseline and your priorities, both health and financial. Weeks 3 through 6 is building the systems and the habits. So the end result is habits and a schedule with target dates. Week 7 through 12 is measuring and adjusting and then locking in an annual cadence. Okay, so the next step, how can we put together the health and wealth flywheel? If you'd like to coordinate a brief health span and wealth span assessment, we can provide you a one-page plan and summary. Feel free to go to calendly.com/Tony D'Amico/intro. You can also email me, Tony@FidatoWealth.com, or at sayhello@FidatoWealth.com. Indicate that you're interested in the complimentary introductory call, and we're happy to provide you a health span and wealth span assessment. So thank you for joining. I hope you enjoyed the video, and cheers to your health and wealth for years to come. Have a great day.